how a cat will sit or how a cow will sit. They have their own particular this one, or same thing with a rat. So visually, whether it is normal or whether it has stretched all its four limbs and then lying, this is the difference. So this is what we have to observe after giving the drug. Now we are all reading. Now I have given a new drug to a particular animal, rat, mice, or whatever testing animal that I have taken, and then I am doing toxicity studies. I have to follow this one. So I should know how the animal sits, dog sits normally after giving drug, how it is sitting. If it is sitting normally, it has not altered the alertness or visual placing is normal. Suppose if the dog has stretched its feet, that means there is something fault. Or suppose if the dog has dropped its head, that means it is causing some effect on the skeletal muscle. So these observations we have to make when we give when we want to do a toxicity study. Then passivity, that is another parameter, that is whether the animal is passive or whether the animal is active. Suppose if rat is there, rat is also a ferocious animal only. So you try to mishandle it or not handle properly, it will give a powerful bite also to the fingers. So now, even if you hold a rat in an abnormal way, still it is not reacting. So it has become passive. So that also you have to record here. Then stereotyping. Stereotyping is another behavior that we have to observe. These are all visual toxicities. Non-visual toxicities, I have told you that after 3 months you have to kill the animal, then only you find what has happened to liver, kidney, heart, etc. Whereas in visual toxicity, we can very clearly see these signs and then we can respond to that one. Go on scoring. What is the score? Severe, less severe, or where quantitative data is there, you write quantitatively. That is blood pressure, respiratory rate. It is fixed. I can measure and then say. Heart rate I can measure and then say. Suppose if it is other parameters, alertness, awakeness, no quantitative data. There you have to write only more alert, less alert, or some 4 plus if it is 100%, 3 plus indicates 75%, 2 plus indicates 50%, 1 plus indicates 25% activity. So where quantitative data is not possible, we go for qualitative data. That is next stereotyping. Stereotyping means animal behaving in only a particular fashion, continuously barking, continuously wagging its tail, or continuously circling around itself, or continuously performing the same act repeatedly. That is stereotyping. So that stereotyping, if animal is doing, better recorded. Animal usually wags a tail, or it can go once or twice around itself. Suppose if 10 times it is circling around itself, that means something wrong with the animal. So that is stereotyping that we have to record. Then grooming. Grooming in the sense, some of the rat and mice, they have habit of grooming. Grooming in the sense, just they scratch their head repeatedly, or their mouth, or this one with the forelimbs. That is called as grooming. So if the animal is repeatedly grooming or not grooming at all, has to be recorded. So that can be due to the effect of a new drug. So compared to normal animals where no drug is given, and this group of animals where drug is given, we have to keep both the cages, sit in front of them and keep on observing. Either you observe, suppose if you feel that how can I observe continuously for 4 hours, then in that you fix a camera, record the activity, then see on the monitor later on and say that what is happening to this one. So later on, suppose if you have gone for an interval of 15 minutes, so what has happened in that 15 minutes? Then you open the record through a camera and then see what is happening, what has happened in that 15 minutes. So that is also permitted. Instead of asking another pharmacologist or another friend to take observation because you are going for interval. You may be going for a cup of tea for 15 minutes and you ask your friend, please come and observe. He is a very good friend. He is also a qualified pharmacologist. So he will say, okay, I will oblige, and he will observe this one and record also honestly. But again, problem where the problem comes, I have told you the example of A and B persons. A is sensitive, B is a stubborn fellow. So his readings are based on his mindset, and in 15 minutes, that fellow will measure on his mindset. So all the data is spoiled. So always pharmacological data has to be done, started and completed by the same person who is doing it. We cannot ask a friend to come and do these studies. because variation in thinking. Somebody writes more irritation, somebody writes less irritation. Somebody writes eyes have become red, somebody says it's a normal color. Somebody says skin fur color has changed. Somebody says no, skin and fur color has remained the same, so there is no change. So this can be totally opposite type of effects, so which will alter our pharmacological data. So that is grooming. And next is vocalization. Vocalization means usually rats and usually they don't produce any sound, especially rabbits. Rabbits don't produce much of the sound also. Suppose if you give your new drug to rabbits and it has started producing sound, that means that there is some pain the animal is suffering, because of which there is vocalization. This is called as vocalization. So that means animal is producing sound. Usually rabbits don't produce any sound. Now it is producing sound after we have given the drug. That means there is vocalization. There is some pain. So that has to be recorded, which can be due to the drug that you have already tested. Then next is restlessness. Suppose if you keep normal rat, mice or rabbit, whatever the animal that you have selected, they have particular activity. Even if it is monkey, when in a cage, monkey does some kind of activities or running, jumping, this one. Now the animal is feeling totally restless and continuously jumping around, continuously moving around, continuously rat is running around the cage. The mice is running continuously around the cage. That means there is some sort of difficulty that the animal is experiencing because we have given a new drug. And the effect can be due to the drug. So while recording, while extending this data to human beings, we should be in a position to say, generally drugs come with warning, isn't it? After taking diazepam, do not drive, or your driving skills are altered. So many drugs come with such warnings. The drug is likely to cause allergy. The drug is likely to cause irritation. The drug is likely to cause some nausea and vomiting. The drug is like, or simple aspirin only you take, they write that the drug is likely to cause irritation of the stomach. So now we have to observe so that these parameters of animal, when we extend to the human beings, we can write a note that this drug is likely to produce this kind of restlessness. The drug is likely to produce particular effect. Or take the case of amlodipine, which is used for controlling blood pressure. Many people, when they take amlodipine for controlling BP, they get peripheral edema. That is swelling of hands and feet. Many of we have seen, maybe some grandfather is taking, or some elders are taking in the house, or your neighbors, somebody who is taking. You can see that those who do not tolerate amlodipine, they get peripheral edema. Either when they go to doctor, either they change the drug, or if it is not possible to change the drug, they give a caution that you take care about this aspect when no alternative is available. If alternative is available, alternative drug is given. So this is how all these animal data toxicity studies play an important role while extending the data and while recording a fingerprinting of a particular drug. Toxic fingerprinting, that is each and every aspect of that particular drug that it produces and the subject has to be recorded. Then only the study on the complete drug is complete. Even a simple drug like an aspirin has been reported to have 300 side effects. If you refer scientific literature, more than 300 side effects are possible with aspirin, which you so happily we go and take as a OTC drug, telling that it's a safe drug, it is over-the-counter drug, no prescription is required. So we go and ask for aspirin tablet through any particular brand name, and then go and take the aspirin. So this is the story of so-called safe drug. Now, if the drug is a toxic drug, you can imagine what else can happen. How many adverse effects can be possible? If a safe drug has 300 side effects, the medically prescribed drugs which have to be taken under medical supervision or after a prescription, you can imagine the intensity of side effects, the number of side effects, the number of interaction that a particular drug shows. So this is where these particular studies play an important role. That is about restlessness. Then irritability. Irritability in the sense, some animals we know about, they're basically calm type of animals are there. Suppose if the animal starts getting irritated, You suppose if a snake is there, it gets irritated, we can understand. If a monkey is there, it is irritated, we can understand. Suppose if an animal like cow is there, which is very docile, and it starts behaving like, very whimsically or irritated, that means the drug is causing some sort of side effect. So that we have to take irritability test. Then fearfulness. This is also another parameter that we have to take into consideration. That animal, suppose let us say tiger is there or a lion is there. So the extreme example, so that you can extend to ordinary animals also. Now, when I go near a lion cage or a tiger cage, in all probability, it will ferociously try to attack. We are outside the cage, that is inside the cage. It will try to attack us. Now, suppose if I go to that animal and animal is running away from me, I am a stranger, I am not familiar person. But if the animal is running away from me or sitting in a particular corner, as in circus, the ringmaster uses a hunter and the animal will start fearing. Like that, without anything, without any hunter or without any electric shock, if the animal starts feeling fearful and runs into a corner of a cage, that means the drug has induced some sort of distortion in the animal behavior that has to be recorded. That is fearfulness. So these are all various tests that are concerned with awareness and mood of a particular subject and how to record them. Next is motor activity. So in motor activity, we have again so many parameters like reactivity. Reactivity in the sense, suppose if I prick a rat with a pin or a pencil, not to damage, but to test how much alert it is. So the moment it feels the pain, it should either attack me, or it should show its defense to me, or it should try to run away. That is reactivity. If nothing is there, keep the animal on the table, it remains or runs around. Suppose if I poke it with a pin, so it should be in a position to bite back immediately. That is normal behavior. So if the animal, even after pricking with a pin, it is not showing any interest, that means the drug has induced some sort of effect. So then it can be a local anesthetic also. Local anesthetic, loss of pain. So when loss of pain sensation is there, even if you prick, we don't get any pain. Eye surgeries, we use local anesthetics. Dental surgeries or extractions, we use local anesthetics. These are day-to-day example. So that means pain sensation is lost in that particular part. So the drug might have caused a local anesthetic effect. So this aspect has to be taken care of. So it can become a very good local anesthetic in future also, like a lidocaine, xylocaine, or procaine, etc. So that aspect has to be studied. Then spontaneous activity. Spontaneous activity in the sense, some animals are very spontaneous. They keep on doing some sort of activity. Like monkeys are there. They don't sit in one place. They either jump from tree to tree, or they pull some next monkey's tail, or it will do some mischievous activity with other monkey. This is a normal behavior or a spontaneous behavior. Now, after giving the drug, whether this behavior has increased or decreased has to be recorded and recorded as a toxicity test. So that is spontaneous behavior. Then touch response. Touch response in the sense, suppose if you touch to a sensitive area, like cornea, I touch with a paper or a cotton. So immediately we will blink. So that is, if I touch, there is blinking. It's a normal response. If I don't blink or if the animal doesn't blink, that means there is some response. Either the animal has become blind, it is not in a position to see anything, or the drug is a local anesthetic, it's not feeling any touch sensation at all. Same thing can be light reflex also. If you hold a torch on the eye, we will blink immediately. Same thing will happen to a rabbit. If you put a torch, it will blink immediately. And suppose if you put a torch and animal doesn't blink, that means the drug has caused blindness to the eyes, blindness to that animal, hence it is not blinking. So that is also quite possible. Local anesthesia is also quite possible. Or some other mental distortion may be there, so that the animal is totally disinterested in the surrounding. That is also quite possible. So all these observations have to be made while testing a toxicity. These are all part of toxicity, whether it is acute, subacute, chronic. Parameters are this only. You have to observe either after 1 day, or after 1 week, or after 6 months, or after 1 year. It is the same parameters. This is a style of recording for this one. Then the next is pain response. Pain response, I have told you, suppose if you prick or pinch an animal, it should react. And if it's not showing any reaction, pain response has lost. As we do Eddie's hot plate experiment, placing the mice on the hot plate, they should start jumping. If it doesn't jump at 55 degrees centigrade, some pain receptors have lost, or pain threshold has increased. To bear the pain is increased, like morphine like drugs. They increase the capacity to bear the pain, and that also can or opposite, they may make more sensitive also. That is also more sensitive to the pain. That is also quite possible. So as a pharmacologist in acute or any toxicity, we should record these things. Then startle response. Startle response is another parameter. After giving new drug, we have to test what is that startle response. Startle response in the sense, suddenly you expose the animal to a very bright light. You keep in a cage, and suddenly you put an 100 watts bulb, switch on the light. So when that sudden light is there, animal should react that some change has come. Or you place a buzzer, suddenly you start a buzzer, animal is there, you suddenly give a sound, animal should react immediately that there is a buzzer. If it is not reacting even after light, sudden light, or sudden buzzer also, sound also, that means drug has caused something fault in that particular animal, hence it is not reacting to startle response. Suppose if some exorcist or some ghost movie you are seeing, suppose a ghost scene is there at a dark cinema theater, and a person X doesn't show any response. Even if ghost comes, a devil comes and eat something and all it does, but this fellow is still without any interest. Is sitting. That means if he reacts, his blood pressure, if it goes up, he is a normal person. If nothing is happening to him, it's not a normal. That means subject is undergoing. There is something. In case of human beings, it can be a psychological problem. In case of animals, there is some problem the drug has induced. So this is how we have to interfere, infer from these studies, inference from these studies. Next is a stop still. Earlier they used to do stop still, now they don't do stop still with morphine. Like suppose if a sample contains morphine and give it to rats, it will show erection of the tail. So erection of tail means a startle response, because morphine causes severe constriction of the sphincters. Anal sphincters are very severely constricted. The animal cannot defecate, hence the tail becomes erect. That indicates there is a morphine-like substance in the sample or in your drug. That is stop still. Then tremors. Tremors is very easy. Now the animal starts shivering. Continue after giving. Normally rats normal, but when you are given this drug, animal has started shivering. So that is, there is a tremor, or drug can induce convulsions, convergent like response. Or drug is a very good drug for heart, controls blood pressure, but it induces this tremors or convulsions. Rejected. A drug is a very good analgesic, but cause convulsions. Rejected. Analgesic effect is accepted, but it is causing as a side effect convulsions, fits, histamine release, anaphylaxis. We have to stop the studies. So that is what is this tremors. Then twitches. Twitches in the sense animal is twitching its body. Normal position, it is twisting the body. When an animal twists its body in an non-usual way, that means the animal is suffering from severe pain. Animals usually stretch. Dogs stretch their limbs once in a while. Cats stretch their limbs, all the limbs, once in a while for a few seconds, and then again they jump back. Suppose if it is twisting the body, that means it is suffering from severe pain. It can be due to a nociception-like effect that is given by the your new drug that we are testing. And then convulsions. If the drug is causing severe convulsions, epilepsy, fits, the drug has to be discouraged from further toxicity tests, should not be given to the animals. Then is we have to observe for body posture. Body posture in the sense, every subject has a particular body posture. I walk in a particular style, somebody walks, person Y walks in a particular style. Suppose if I bend both my shoulders and bend my body and walk, till afternoon I have walked straight, but now in the evening I have bent my body and started walking. It indicates that there is some complication, maybe stomach ache is there, or some complication is there in that subject. That is, his normal posture is altered, isn't it? Suppose person has a very severe stomach ache, he bends his whole body. That indicates that otherwise is normal. So when stomach ache is there, he bends his body. That means the subject is suffering from severe pain. Like that in animals also, the subject may suffer from severe pain because of the drug, and its posture has changed. Posture in the sense every the way of a dog is different, way of a cat is different, a monkey. So if there is a pain, there is change of this body posture. Then limb positions. We all have seen how a dog sits in our home. We have seen how a lion sits in its cage or a cave, how it sits, how a tiger will sit, isn't it? They have their own particular style of keeping the limbs, or how a cow will places its limbs. Particular style is there. If that is changed, that means drug has caused some severe discomfort in the maybe skeletal muscles or centrally, and hence the animal is not in a position to keep its legs in a normal way. That is a limb position. Then staggering gait. This is staggering a gait. Gait in the sense a body posture is called as a gait. GAIT, gait. Gait means how a person. You can see some wrestler how they walk. A boxer how he walks. That is a gait. That particular style, or how a cinema hero is there, how he walks, or villain is there, how he walks, or his body posture. So that is called as a gait. Staggering a gait in the animals too have a particular gait. Dog has a particular gait. Cat has a particular gait. Elephant has a particular gait. Horse has a particular, any animal that you imagine, they have a particular style. So if that style is altered, if a horse is walking in an erratic way, or its body posture is totally bent or something like that, that means there is some problem that is induced by the drug, and we have to identify what is that problem. That is called as staggering gait. Then abnormal gait. One is staggering gait. Staggering gait in the sense excessively stiff, it can be staggering. Abnormal in the sense, as I gave the example of stomach ache, body bending. So that is abnormal gait. Staggering in the sense excessively stiff. Suppose there is a fight between normally hero walks in a style, villain walks in a particular style. Suppose if they both come face to face for a fighting, so both will start showing a lot of stiffness in the body. So that is staggered gait. Normal gait, staggered gait, and how they can take up a fight. So that is staggering gait. So if a drug is inducing that in an animal, that means the animal is causing the drug is causing some sort of discomfort, some sort of behavior in an animal, whether it is on the central nervous system, or whether it is on a skeletal system, whether it is on an autonomic nervous system. That we have to, as a pharmacologist, we should draw the inference, because animal will not tell what is happening to it. We have to draw the conclusion. As a pharmacologist, we should be skilled to draw the conclusions from the animals, as they will neither write nor tell nor express themselves. Then writing reflex. Writing reflex is again a very simple writing, not WRIGST, writing. Writing reflex is a very simple exercise. We have seen examples of a monkey jumping from your rooftop. It will land perfectly well. A dog from a rooftop jumps perfectly well. Compound, it jumps perfectly well. It jumps and says. A cat jumps from a tree perfectly well. It lands. Suppose human being falls from a second roof of a dog, he will not land very perfectly. He will land in a very odd way. He will land. So that is what is uh, uh, we have recorded that as a particular writing reflex. Writing reflex in the sense, suppose if a rat is there or a mice is there, you keep it dorsally this way. It will not lie like this. It will immediately jump back to normal position. That is a writing reflex. That is, when a particular subject, a cat or a dog, jumps from this one, it will land perfectly well. It will not, a cat will never land with limbs up and body down. Human beings will fall in any typical positions, and they will lose their life also. But monkeys and these things, dogs, cats, they will never land in an odd position. So that particular style, that is writing reflex. So for a particular rat, if you give a drug, keep it in a reverse way. When it is kept in a reverse way, it should come back to its normal position. And after giving the drug, You have kept it reversed. It is still not coming to normal position. That means a writing reflex is lost. If writing reflex is lost, written as negative sign. If writing reflex is present, positive sign. So that is also a toxicity test. It can be induced by so many drugs. That is, the animal will not catatonia, especially drugs that induce catatonia, like your phenothiazine derivatives, perfenazine, that are given either for tranquilizer effect or for other effects. When they are used after a long administration into human beings, they induce a lot of muscle rigidity or incoordination, muscle incoordination. So in rats, we call by simple terms, right, writing reflex there, because muscle incoordination is there. That is writing defect. Then limb tone. Limb tone in the sense particular strength of that particular animal. Dog is there. Let us say it will jump at least a distance of 8 feet. Now it is jumping only 1 feet, or it is jumping 20 feet. So that is what has happened to limb tone. Both are possible. Either it has increased or it has decreased. Pain. Either the drug has increased the pain sensation or decreased the pain sensation. Allergy, either it has caused more allergy or it is anti-allergy. Stimulation, drug has caused stimulation or depression. So observation in the sense exactly opposite. Both can be observed. It can be diuretic, it can be an anti-diuretic. Suppose if I am interested in a diuretic drug, but turns out to be an anti-diuretic drug. So I should not say that a drug is not at all a diuretic, I stop the studies. I should be in a position to claim that the drug is an anti-diuretic drug. So wherever this diabetes insipidus is there, this drug can be used to control the uncontrolled urine flow. So that is how we have to infer. Both observations should be done by a particular pharmacologist. Then grip strength. Grip strength is again a very simple thing. They are all very interesting, almost like story only. How we elaborate this pharmacology. Grip strength. Suppose I am hanging to a bar. Usually I hang. Let us say for 2 minutes or 3 minutes I hang. Now after taking the drug, I am hanging for 10 minutes. That means the drug has given more energy. Suppose if I lose my grip within 10 seconds, my normal capacity is 3 minutes. If for 10 seconds I lose the grip, that means the drug has caused muscle relaxation. So in rats, how do we study this rat? We do by a simple rotarod test. Rotarod apparatus is there, a rotating rod is there. You keep a rat on that one. Normally, let us say a rat will sustain for 30 seconds or 1 minute. Now, when after giving the drug, even after 5 minutes, the rat is not falling from a rotating rod. That means the drug has given more muscle strength or muscle grip. Suppose if it falls in 5 seconds only, the drug has caused muscle relaxation and hence the rat has fallen. Various drugs are there. Simplest example is your diazepam, which we take for sedative and hypnotic effect. Whenever in anxiety or for to get this one sleep abnormality, doctor may recommend a diazepam. But a diazepam, the desirable effect is only hypnotic sleep, but its undesirable effect is muscle relaxation. We are not interested in muscle relaxation, but this unwanted effect is a desirable effect in a patient, because person is so much tired and become fatigued. He wants a good sleep as well as he wants all the muscles to be relaxed so that he is very comfortable. So that is how the second effect or the side effect may be useful or may not be useful also. So this is what, suppose if a patient is a myasthenia, just again let us extend the logic. Person is a myasthenia gravis patient and he has taken diazepam. Already that fellow is a myasthenia gravis patient. He cannot lift one glass of water because muscle weakness is there, and the diazepam further causes muscle relaxation. He cannot lift even one spoon also. Same effect. It is unwanted effect there. Suppose a normal person is there, he has exhausted morning till evening, he has taken one diazepam, his muscles are relaxed. It's a desirable effect. For a myasthenia patient, undesirable effect. For a normal patient, it's a desirable effect. So this is how we have to define, we have to differentiate what is needed, what is not needed, what is useful, what is not useful, has to be taken care of. That is grip style. Next is body sag. Body sag in the sense, now the again a common example of dog. Let us say the dog is dragging both its hind feet. It is walking by dragging. It's not walking. It's a dragging its feet. That means either there is a muscle relaxation or paralysis of hind limbs in the dog, hence it is bragging. So after giving the drug, if we find like this, then we say that this effect is due to drug. This is a toxicity profile that we are recording. Then body tone, same thing, like limb strength, body strength, whether it is increased or whether it is decreased, that also we can make out. Then abdominal tone, same thing. Abdominal tone in the sense a distended stomach is there. So this can be the effect of a drug. So stomach is normal or stomach of the animal is very much distended. We find in common human beings, many times we feel, isn't it, that stomach upset is there, or swelling of the stomach we feel, or tightness we feel. Same thing can happen in animals also. So this can be side effect of a drug. So as a acute toxicity or chronic or we have to record this parameter. Next, another parameter that we have to test is reflexes. That is pinna reflexes. What is that? Pinna reflex. Pinna reflex means ear reflexes. Usually for a rat and a mice, if you touch this ear lobe and pinch or touch it with a forceps, it will feel the pain. So now after pinching or holding, lifting the rat with its ears, it is not showing any pain or discomfort. That means pinna reflex is lost. Or the moment you touch its ear, it starts squeaking and producing sound. That means the drug has caused more pain in the pinna or more sensitivity in the animal. Hence, pinna reflexes have become more sensitive. So, pinna reflex present or increased or decreased. This also has to be recorded. Next is corneal reflex. Same thing, you like startle response. Startle response, sudden bright light. In corneal response, a small torch, a mobile torch or a small torch also if you put, if the animal blinks, that means animal's eye is normal. If it is not blinking, even after putting a torch, that means the animal has got cataract because of your drug, and it is not showing any response. Or the drug may be a local anesthetic, there is no response because of that also. Or drug may be some sort of a toxic drug which has caused toxicity like blindness or some sort of damage to retina or rods and cones. That can also be possible. So again, through histopathology only we can make out, but you can externally you can record what is happening to the eye, that is corneal reflex. Then IFR or ipsilateral reflexes. Ipsilateral reflexes indicate the limbs, rat limbs, etc. If you press or if you press with a forceps, it will stretch immediately. So even after pressing with a forceps, if it is not showing reflex or not showing any stretching, that means there is ipsilateral reflex is lost. It can be due to drug. So we have to be alert. This can be due to drug. This may not be due to drug also. Because out of 6 animals, only one animal is showing like this, 5 they are very normal. So it can be due to some other reasons. So out of 6 animals, 3 animals are showing, that means 50% there is a risk of toxicity. Out of 6, all the 6 are showing this one, that means 100% the drug is toxic. Only one animal is showing like this, it can be accidental observation or it can be some other reason, can be due to drug in a mild or a sensitive subject also. So again, this also has to be recorded. Then next is writhing. Writhing, W-R-I-T-H-I-N-G, writhing. Writhing in the sense a severe twisting of the body is called as severe pain. And a subject experts rat like this one. A best example of writhing is, suppose if you give experimentally as a pharmacology experiment only, we do this test also. If you give agents or chemical like acetic acid, dilute acetic acid, if you inject into the rat, it will induce so much discomfort and pain to the animal that it will twist its body. Sometimes they die also, and causes so much discomfort and pain. This is nociception or injection of hypertonic saline in a rat. It causes nociception and writhing. Writhing in the sense body it starts bending in a very typical way because of discomfort. That is writhing. So if the animal is showing writhing when you have tested a new drug in a rat, that means this toxicity can be due to your drug. Again, as I said, it may be in only one animal. So that means some sort of writhing is there in one animal, or it may be pure accidental. Animal is suffering from some disease, and accidentally we have given say this drug, and it is showing everything. 5 are very normal. Or suppose if it is seen in 3 animals, there is quite possibility that it is seen in all the animals. Or 3 are very much resistant, 3 are sensitive. So all these observations we should make while doing. Then pupil size of the pupil, you can measure with a scale also. Pupillometer is there, you can measure with a scale whether there is dilatation, the drug is mydriatic, whether there is constriction, if the drug is meiotic. This also pupillary size we can measure this one. Then the next is exophthalmos eye toxicity only. Exophthalmos indicates protrusion of eyes. Eye remains in a socket. Suppose let us say the eyeball has come out, most protrusion, bulging of the eyeball. That means it can be due to glaucoma. Drug is causing glaucoma in the eyes, or drug has caused exophthalmos, that are unbearable pain in the eyes. So eyes are balls are coming out. So all these observations have to be made. So wherever, whatever organ you imagine, the drug can be toxic to that one. Our desirable effect is something, and undesirable effect can be somewhere else. Drug is meant for a headache, but drug is causing allergy on the skin. Drug is meant for a headache, drug is causing hypertension. Drug is meant for a headache, it is causing loose motions. Drug is meant for a headache, it is causing increase in insulin level. Drug is meant for headache, it is causing decrease in insulin levels. Drug is meant for headache, it is causing more diuresis. Anything, because our intention is headache only, but it is causing effect on some other organ which is unwanted. So we should be observing about this one. And then next is urination. Very simple test. Keep 6 rats and in a meshed cage, and keep a funnel and collect in a beaker, and after 4 hours, 2 hours, measure the volume of urine. In a normal group, let us say 10 ml of urine has come out, and in a drug tested group, the drug that you have given, there is 15 ml of urine. The drug can be a diuretic drug. Suppose the urine formation is only 5 ml, in normal it is 10 ml. After giving drug, it is 5 ml. The drug is an antidiuretic. So this also can be done. Uh, Whether it is a toxic effect depends. As I said, suppose a person is suffering from already a diabetes insipidus, wherein the frequent urination is there, and even from 10 ml to 12 ml change in urine also is a severe punishment for that fellow. So this we have to take care of while doing this one. Or if it is antidiuretic, it may be beneficial effect in case of diabetes insipidus. This observation also has to be made. Then salivation, very simple test. Whether more saliva is coming, less saliva is coming. It is difficult in smaller animals like mice and rats, but very easy in animals like cows. Salivation is there. Dogs, common salivation is, dogs salivate continuously. So the experimental dog, you should tie some sort of a beaker to its mouth, and tie the limbs, etc., in a suitable cage, so that it doesn't disturb itself, and collect the saliva collected. So it may be a saliva, it may be atropine-like drug which causes dryness of the trunk, so no saliva at all. That is also can be measured. Then piloerection. Piloerection means hair, body hair. Suppose suddenly you see a horror cinema, body hair will stand up. Or you see suddenly, not use any subject, suddenly uh, every time I'm using you, it's not exactly you, any subject. If you suddenly sees, suddenly a tiger has come in front of the door, suddenly there will be erection of the body hairs. So that is piloerection. So if it is a piloerection, it's a normal phenomenon by seeing such situation. But if it is due to drug, there is piloerection. That means the drug is causing some toxicity on the skin, that has to be recorded. That is piloerection. Then hypothermia. This is very simple. Keep a thermometer in the rectum and measure the temperature. It may be a hyperthermic, body temperature may be increased, or body temperature may be decreased. If body temperature is increased, record that the drug is a pyretic drug, it causes pyrexia or hyperthermia, increase in body temperature. If the given drug is reducing the body temperature, write that the drug is causing hypothermia or a lytic drug. So this also can be recorded. Usually hyperthermia is common, hypothermia is not common. subject will survive if there is hyperthermia. If a person suffers from 102, 103 degree fever, he may not die. Suppose temperature falls down by 1 degree, that subject will die. That is hypothermia. But in certain surgical cases, doctors want an hypothermia situation. It is called as a lytic cocktail in pharmacological language, a lytic cocktail wherein phenothiazine like drugs are there. They are used to reduce the body temperature by 0.5 or 1 degree centigrade during surgeries, certain surgeries. So there, if hypothermia is there, it is a desirable effect. So the drug can be used for that one. But when the drug is meant for a headache and it is causing this hypothermia, hyperthermia, it is a totally an unwanted effect there. So the drug is of no use there. So this is what we have to record. Then skin color, easily visible to the eyes. The skin color has become more red in color or pink in color or erythema, eruption or redness of the skin or rashes and some color discoloration, bluish coloration of the skin has seen. That means the drug is causing cyanosis. The drug is causing erythema. A drug is causing some toxicity on the skin or its fur, hair, etc. Can be one of the drug. Suppose if a drug makes the hair black, drug is meant for hypertension, it is making hair black. It can be an advantage, desirable side effect. Suppose if the exactly opposite, drug is making hair white. It may be desirable, it may not be desirable, depending on the person who wants. Somebody is fond of gray hair, somebody is fond of golden color hair, somebody is fond of white hair. So it may be a desirable effect, but the person who wants black hair, it is an undesirable effect for him. So like that, whenever side effects we get, we should be in a position to define whether it is a desirable side effect or undesirable side effect. Or simple example is chloroquine, anti-malarial drug. Chloroquine, you have seen in COVID, what was the demand of that chloroquine, hydroxychloroquine. Even American countries had threatened for chloroquine to India. So that chloroquine is an anti-malarial drug, but they tried in COVID situation. Chloroquine, after in malaria, if we use it, causes a bleaching of the hair. So hair become white, including eyebrows and eyelashes. They also become white permanently. Only we have to apply dye. That's all, hair dye, black color dye. So bleaching, but their intention is we don't have any other drug. We want to save the life of a person from COVID. So even if the hair or eyebrow become white, no problem. Fellow will survive. Our intention is to save the life, not to bother of eyebrow color or eyelash color. Even it is white, it is acceptable because person is alive. So like that, side effect we have to see whether it is desirable, undesirable, in which subject it is desirable, in which subject it is undesirable, and how to utilize that drug. Then heart rate, we can measure. This is also one of the toxicities. Then respiratory rate, easily measurable. We can measure the respiration and say the drug is causing increase in respiration. Like coramine drugs are there, caffeine like drugs are there. They can increase slight increase in respiration. Or some diazepam like phenobarbital like drugs are there. They decrease the respiration. So again, we have to record what is happening and make a chart of that one. That is called as total fingerprinting of a drug. And depending on the type of effect, if you are interested, suppose you are recorded some 25 such effects, and the drug you are interested in some hypertensive, antihypertensive drug, but now the drug has become is causing hirsutism, excess growth of the hair. Now you forget all these studies, work only on the people who want black hair or excess growth of the hair, and the scientist may be interested in manufacturing a drug out of that one. He has forgotten anti-hypertensive theory, hypertensive theory, and then he has gone for only hair tonic for growth of the hair. He may again become a very good scientist who has invented that drug. Purpose was to find out a very good drug for hypertension, but what it turned out, he left all that one and he started selling the hair blackener. Such things also are quite possible in the life of a scientist. So but we have to record. And suppose when we have fingerprinting and you are interested in working on a particular parameter, you can work on that one. So there also you can make out what is the toxicity level and what toxicokinetic, which molecule is toxic out of that drug, and which how it is absorbed in the body, where it is metabolized in the body, where it is distributed in the body, that toxic molecule, whether it is bound to plasma protein, whether it is freely moving, and if it is eliminating from the body, and at what time it eliminates from the body, whether it in the urine it is eliminated, whether in the feces it is eliminated, whether through bile it is eliminated, whether through skin it is eliminated, whether through saliva it is eliminated, whether it is eliminated through lacrimal secretion. All these things, as a scientist, we should make a recording of this one. So these are all visible. Next level of toxicity studies is directly not visible, which includes teratogenicity, that is fetal toxicity, then enzyme levels we have to measure, then liver toxicity, kidney toxicity, CNS toxicity. These things are possible only when we sacrifice the animal and do histopathological studies. So this is all part of what is called as Irwin's test, or acute, subacute, and chronic toxicity test. So in today's discussion, we have basically seen about what are these various toxicity tests are there, and chronic, acute, subacute toxicity is, and how animal data is extended to the human beings. So these aspects we have discussed today. So two classes we have completed. In tomorrow's discussion, we'll go to GLP. Actually, I wanted to cover GLP, but since already we are speaking from 1 hour 45 minutes, I think this should be enough for today's session. So GLP, tomorrow's class I will take, and I will discuss about alternatives to animal experiments and schedule Y. That is tomorrow. Day after tomorrow, we'll see about CPCC. That is Committee for the Purpose of Supervision of Experiments on Animals. CPCC guidelines. So many guidelines are there. OECD, ICH, ICMR. They're all same overlapping guidelines. Even if you study any one, it covers the CPC guideline. You can study it as CPC. You can study as ICM, and Indian Council for Medical Research, or International Committee for Harmonization, ICH guidelines, or OECD guidelines. So that is Organization of Economic Cooperation and Development. All the guidelines are the same thing, overlapping type of. Earlier it was UGC guidelines, then INSA guidelines came in India, University Grants Commission guidelines. Then after UGC, it became ICMR, Indian Council for Medical Research. Then it became INSA guidelines, Indian National Science Academy, INSA guidelines. Now it is international one. Internationally, we have CPC guidelines and ICH guidelines. They are all overlapping. Anyone if we discuss, that is also almost very comfortably like a story only we can discuss. That we'll discuss on Sunday's session, and tomorrow's session we'll try to cover GLP, that is good laboratory practice, and alternatives to the animal experiments. So I think we are maintaining our pace, and now the session is open for discussion. Maybe a couple of minutes. If you have any doubts or anything, you can definitely ask me.
So participant, if any questions are there, you can ask.
Now, if you don't ask the questions, then you are not interested in this. That is the conclusion. Dr. Nitin Mahurkar sir has taken so much of interest and he is discussing. And if you people are not interested in understanding and responding, what is the use? Good evening, Nitin sir.
Sir, good evening, sir. If no questions means probably they have understood everything thoroughly. That was meant for them. And with your permission, we can log off.
Sir, now you're explaining detailed behavior of the animal, so human behavior also you can understand.
Right.
So, sir has explained in detail animal behaviors and how any drug testing shows any toxic effects. So in detail, he has explained. So because of his experience and handling the different animals for different models, different activities. So because of his practice and practical experience, he can explain so much. So on behalf of all of us, I'm thankful to you, sir. Again, we will meet tomorrow.
Sure, sure, sir.
Patil sir, you want to say anything?
Very nice discussions. Taking
Yes.
back to my days of experimentation.
Yes, right.
So, students, you are free to ask the questions. Probably I will snatch this opportunity from Dr. Mahurkar sir to answer some of your questions.
Sure,
Because
Yesterday, Nitin sir told that drug, we are knowing much about the chemical taste. We are not that much exposed
sir,
to drug and animal interaction.
yeah, that is there.
Because of that, maybe we are lacking
Mm.
that exposure.
Because of the CPCSCA stringent guidelines and
Yes.
Cruelty to Animals Act, Prevention of Cruelty to Animals
right,
Act.
right.
So these things have brought down tremendously the opportunity.
Mainly we have missed our favorite animal, frog. No more frog experiments now.
So lots of experiments we used to do. So if
Sir, now
any
you can try. You can try, sir. Now PCI president is
No,
changed.
no,
So
no, 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 no. That will cause ecological imbalance. Problem is this one. The entire system cycle is getting altered.
yes, yes.
no, as far as frog is concerned, it is right. But with rats, mice,
Yes, it's permitted, very much permitted. Wherever we can breed the animals, it's permitted. Wherever we cannot breed, frog breeds only in froggery, in a dirty pond. It will never breed in an hygienic environment of laboratory.
no, frog is the animal which breeds in its natural habitat.
Natural habitat. Natural
So
habitat, that's a problem.
there are PhDs, many PhDs awarded on this studies, particularly right from the Karnataka University, Harvard
Right.
Zoology Department and all.
Because
A
excellent
lot of
animal for so many studies. So many heart is there, intestine, stomach, and rectus muscle and blood vessels. So many things we can
buccal
do with
cavity.
frog. Buccal cavity. So many things.
Yeah. So many
okay, we'll
new.
stop here, sir.
Yes, sir. Thank you, sir.
Yeah.
Thank you, and good night.
Thank you, sir.
Right.
Good night.
Thank you.
I will.
Good night.
I will log off, sir. Thank you. Thank you.
Students, you can leave the meeting.